Welcome to the picture guide for changing the Y adapter on a Corflo PEG. This guidance is only valid for during the COVID-19 emergency. Introduction. This picture guide has been produced in response to the COVID-19. It has been produced following a review of current clinical guidelines and manufacturer's guidance. The aim of this guide is to encourage self-care for patient carers and family members. Preparation. Step 1. Please wash your hands, prepare a clean surface near the patient or yourself or your relative, and then please wash your hands again. Preparation. Step 2. Preparing the equipment. The equipment you'll need is a spare Y adapter, which you'll see in the picture coming up. The spare Y adapter should be delivered from Nutricia, and it looks like the following. You'll need a clean pair of small scissors and a clean pair of kitchen roll or towel to pop under your patient or relatives or your own G-tube. Thank you. Equipment. Your Y adapter. Please take the Y adapter out of the packet as indicated below, and please take note of the skirt as the arrow indicates below. Please unscrew the skirt and just take it off so you've got two separate pieces. This means your Y adapter is ready to be placed onto the end of your Corflo PEG. Preparation. Getting comfortable. If you are the patient, you can either sit in your chair or get yourself comfortable in bed at a minimum of a 45-degree angle. You must make sure you place the equipment within easy reach and ensure your PEG and your PEG site is clean around this if it's required. Wash your hands and then you can pop yourself in your chair or your bed and make sure you've got easy access to the end of your PEG tube and the Y adapter needing changed and your equipment. Step 3. If you're a carer or family member, please position your relative or patient in a comfortable position, either in the bed or the chair at a minimum of 45-degree angle, with easy access to your patient or relative's PEG tube. Make sure the equipment is within easy reach, and please make sure that the PEG site and the PEG tube itself is clean around if required. And now please wash your hands again. Procedure. Step 4. Removing the broken end or the Y adapter. Please clamp the tube, place the towel or kitchen roll underneath your PEG or your relative's PEG or patient's PEG, and unscrew the broken end of the skirt as indicated below. The tube should just end up looking like this in the middle picture. If you're unable to unscrew it, please just cut squarely underneath the skirt with the scissors that you've prepared earlier. And again, your tube should just look as pictured in the middle below, just a plain tube with nothing on the end. Step 5. Replacing the Y adapter. Wipe the end of the PEG and take the new skirt and push the PEG tube end through the narrow end of the skirt as indicated in the picture below. Once you've done this, push on the other barbed end of the Y adapter, the second piece, onto the end of the PEG as indicated in the picture below. It's important to push over the barb until the tube stop is reached as the arrow indicates below. And finally, the last step is just to twist and push the skirt to the skirt stop. So you just put the skirt all the way up and twist it on and to the bottom of the small dome and twist it tight. That's you finished. Wash your hands and tidy up. Please make sure you order a replacement end from Nutricia if you've used your last one. If you've got ongoing issues with breaking the Y adapters, please contact your DN service during core hours to discuss. Also, please note if you're having to repeatedly cut your tube to remove the broken Y adapters, please only do so on 2 separate occasions. And after the second time, please contact your DN service again during core hours to discuss. Thank you for your time and I hope you found this guide helpful.